Coronavirus cases are rising in 22 states, including Oklahoma, where you plan to hold a big rally this week. Aren't you worried about people getting sick?
No, because if you look, the numbers are very minuscule compared to what it was. It's dying out. No, we're not concerned. Actually, Oklahoma has had a very low rate, relatively speaking.
Ay caramba. Yeah, that's the same guy that said it was one or two people coming in from China. They've been taken care of, that it was going to go away in the spring. It'll be done by Easter. Just ever stop spreading disinformation, and people died because of that. Was then President Donald Trump 4 years ago. Yesterday, once again, brushing off concerns about holding an indoor rally in Oklahoma in the midst of the COVID-19 pandemic. Just a few days after that event, the state would set a new single-day record for coronavirus cases, which health officials said likely was caused by Donald Trump's rally. Trump held that event despite warning from its top members of the coronavirus task force, including Dr. Anthony Fauci, and the former director of the National Institutes of Allergy and Infectious Diseases joins us now. He also served as President Joe Biden's chief medical advisor before retiring last year. Today, he's out with a new memoir titled On Call, A Doctor's Journey in Public Service. Dr. Fauci, thank you so much for being with us. There's so many questions we could ask you. I just want to start with an overview. What's the main message of this book? What do you want readers and Americans to take away from what you've written?
Well, I believe there are two main messages, Joe. The first is that is somewhat of an unusual perspective that I had for being at the NIH for 54 years and being director of the NIAID, the Infectious Disease Institute, for almost 40 years. And I had the privilege of dealing with 7 presidents through some of the most impactful outbreaks of infectious diseases in history. It's bookended by the early years with HIV and then the last years of my career there with COVID. And it's been an extraordinary journey, as I say in the title, in public service. So I thought it would be a good way to get a personal historical perspective, but also I hope that it encourages young people who have any interest in medicine, science, public health, or even public service of how gratifying that a career in public service can be. So, 2 reasons.
We could ask again a lot about your time with Donald Trump. It certainly was extraordinarily momentous because of the pandemic. I am curious, though, looking back through the years, across the decades, your public service. What are you most proud of? What do you write about in here? And as you were going back through the years, did you think, wow, we really got that right?
Well, there are several things. You know, the very early part of my career, when I developed some remission-inducing therapies for diseases, this is way before HIV, that were really very, very highly fatal diseases, inflammatory autoimmune diseases. And then in 1981, things changed, and I started on HIV, which was, you know, a 40-year journey of first what was almost hopelessness of almost exclusively young gay men in the early years of the 80s, to the development of drugs and the essentially turning around the life of these individuals in collaboration with the pharmaceutical companies. I'm most proud of the role I played as the director of the Institute in getting these drugs to save so many lives throughout the world. But probably one of the most important things that I'm proud of is working with President George W. Bush to put together the PEPFAR program, the President's Emergency Plan for AIDS Relief, which now, 20 years into it, has been responsible for saving 25 million lives, mostly in the developing world and mostly in sub-Saharan Africa. And finally, my institute, the vaccine center that I established when I was director, played a major role in the development of the COVID vaccines, again, in collaboration with the pharmaceutical companies. So it's been a very long journey, and there are several landmarks in there that I feel very good about.
So, Dr. Fauci, 40 years of helping and/or healing, sometimes both at once. In all those 40 years, Could you ever imagine the impact that the latter years dealing with COVID, dealing with the virus, helping cure people with the vaccine, that you and your family would come under such a sustained political assault?
No, that never in my wildest dreams would have occurred to me. I mean, there had been disagreements all along. I mean, having advised 7 presidents, it's very, very likely that you're going to get differences of opinion, diversity of political ideology, and people would sometimes try and, get one point or so over the other. We saw that all the time. But it wasn't the profound degree of divisiveness now, where instead of having diversity of opinions, we have profound division, vitriol, and ad hominem, which is completely different. Even back when Republicans were, mixing it up with the Democrats and arguing about things, there was always collegiality, there was civility, and there was respect for institutions. Now, in the last few years, it's sort of disappeared.
To follow that question, we now head into a moment where, because of that divisiveness, it's become a political issue. Like vaccinations in particular have become a political issue, where you have not just Donald Trump, but other Republicans saying, no, don't take the COVID vaccine. We have other prominent figures saying, no, you should not take other vaccines as well for other things that have been standard, that everyone has perceived for decades. So with this much of disinformation and anger and just flat out vaccine hesitancy, how nervous are you about our ability to handle the next pandemic, whatever it might be?
I'm very concerned about that, because the misinformation and disinformation about absolutely scientifically proven life-saving interventions, it's astonishing to me that so many people, by political ideology, will make a decision that would actually endanger their lives. I mean, the facts are, and as a physician and a scientist, this is very painful to me, that if you look at red states versus blue states, because of people getting less vaccinated because you're a Republican versus a Democrat, there are more deaths and hospitalizations in red states versus blue states. That's horrible that happens, that people suffer and die because of misinformation that's related to a political ideology.
Dr. Fauci, we're in an environment right now, unfortunately, in which Americans' faith and trust in institutions is arguably at an all-time low. It's not only public health, it's not only science, it's government, journalism. So there's a lot of soul searching going on right now in those institutions. I wonder, though, if you think that public health has some soul searching to do in terms of how it lost the trust of the American public, especially thinking about the early days of the pandemic, where not only Donald Trump, but even public health officials at all levels of government were not telling Americans what they knew about the virus and what they didn't know, but arguably telling them what they thought they needed to know and got it wrong in terms of the need to wear masks, in terms of the virus being airborne, led to 30,000 deaths in 6 weeks here in New York City. Is there any soul searching to be done there?
There's always soul searching to be done in anything, particularly as extraordinary as a pandemic that killed 1.2 million people. Nobody's perfect, and nobody did everything right. We did a lot of things right, but not everything right. I would take a little issue with what you're saying about telling people what we think they want to hear. I think what we need to do better is to get people to understand that we were dealing with a moving target, and science as a discipline is self-correcting. So that if you look at what's going on in January and February of 2020, what we knew then, what we knew about the virus, and the fact that the virus was changing, we need to make it more clear to people that we will report what we know based on, in real time, what the evidence is. If the evidence changes, the public can sometimes get the opinion, well, these scientists are flip-flopping. They're changing their mind. We need to understand better and explain better that science is a discipline that allows you to collect information. And when that information changes, science demands that you change your opinion based on the new information. We didn't do a very good job of that.
Joe.
Yeah, we're talking about the first pandemic since 1918, 1919. And, we often talk, Doctor, about the fog of war. Well, this pandemic was a war of its own kind with over 1 million people dying. And I'm just curious how frustrating it is to you that people will go back and pick up something that you may have said in March of 2020, or something that another health official or a politician may have said later in that year, whether it's about masks or vaccines or anything. We didn't know. None of us knew where this was going. None of us knew, like, for instance, how long would the vaccine work? Would we need one booster every 5 years? Would we need one every 5 months? How frustrating is it to you that people look back with 2020 hindsight and judge you when you and the rest of the world was in the fog of war?
You know, it is quite frustrating, Joe, and that relates exactly to the answer to the question just a moment ago, where I was saying that people really don't appreciate. I don't blame them for that, but they don't appreciate that we were dealing with a moving target. And when we were saying things in the beginning, wear a mask or not, how the virus is spread. I mean, originally it was felt, understandably but incorrectly, by the CDC that it is spread by the same way that flu is spread, namely mostly by droplets, when in fact most of the transmission is not only by not droplets, it's by aerosol, but also 50 to 60% of the people who transmit it have no symptoms at all. We didn't know that in the beginning. It was a changing, moving target. You're absolutely right. Was it frustrating? It was terribly frustrating because people like to take things out of context and do a gotcha. That's part of the reporting process. And I accept that. It's the world we live in, but it certainly is frustrating.
Yes, well, we greatly appreciate you being here. We appreciate your service through the years so much. The new book is called On Call, A Doctor's Journey in Public Service. Dr. Anthony Fauci, thank you so much. Great to see you.
Thank you.